COVID hospitalizations nationwide are up more than 100% in the last month. Rural hospitals in particular are at a tipping point. Nearly 20% of Americans rely on them. And tonight, CBS's Carter Evans takes us inside a hospital in Rupert, Idaho that's bracing for an onslaught of COVID patients.
COVID is now ravaging rural America. Today, we got a first-hand look inside a small Idaho hospital, Minidoka Memorial, with just 17 beds and a staff overwhelmed.
Super exhausting. You leave here tired. You might even start your shift out tired.
This hospital doesn't have an ICU, but there are 3 beds now for COVID patients. This 85-year-old man is infected and struggling to speak.
He's pretty weak, and that's one of the common symptoms for a lot of people.
Large cities initially bore the brunt of the pandemic, and while COVID cases are increasing again, nowhere are they rising faster than rural areas. In Idaho, 1 out of every 4 COVID tests come back positive, but many here still refuse to wear masks.
Everything you do is based on the mask and the disease, and it's wrong.
When you see people not protecting themselves, what do you think?
We know we probably will see him someday.
The impact is being felt nationwide.
It's relentless. It's day after day. It really takes a toll.
A hospital in Topeka, Kansas, so overrun with COVID patients that some are being kept in hallways and waiting rooms until an ICU bed becomes available. The Mayo Clinic is now reporting more than 900 staff members infected with COVID just in the past 2 weeks. In Reno, Nevada, these beds are in a hospital parking garage. By tonight, as many as 40 COVID patients will be housed here. The toll is grim. 10 members of this Ohio family are infected with COVID. Deanna Gibson just buried her husband, Ben.
He beat all these health battles, and then COVID killed him.
Back in Idaho, the fear is that the worst is about to hit.
Is there a possibility that all your beds could fill up?
So I do see that going to happen, yeah. I do see it will fill up fast.
Now, when they get a critical patient here, they already have to transfer them to other hospitals in the state. So what happens when those hospitals are full? Well, at that point, doctors will have to decide who gets a bed. And the chief medical officer at Idaho's biggest hospital tells me that could happen within 2 weeks. Nora?
Carter Evans, thank you.